Hello, I'm Kara Dupuy, and I am a pulmonologist and sleep medicine specialist at Mayo Clinic in Rochester. I'm also the chair of the Communications Committee here at the Society of Anesthesia and Sleep Medicine, or SASM, and the host of the SASM podcast. And I'm really excited to bring this interview to you today. It's a very special interview in advance of our national meeting, which is happening in San Antonio on October 10th. And I have one of our speakers who's going to be presenting at the meeting, Dr. Joshi. And Dr. Joshi, if you want to start by introducing yourself, that'd be great.
Thank you, Kyra. Thank you for inviting me. My name is Girish Joshi. I'm a professor of anesthesiology and pain management at the University of Texas Southwestern Medical Center in Dallas, Texas. I'm also the past president of SASM, as well as past president of SAMBA, which is Society for Ambulatory Anesthesia, and past president of Texas Society of Anesthesiologists. It's an honor to join you, Kara.
Wonderful. Well, thanks so much for giving me some time today to talk about your upcoming presentation. So you and Melissa Byrne are going to be speaking on GLP-1 management in the perioperative setting. Can you just start by telling me why you chose this topic and what you think is important about it?
The GLP-1 receptor agonists, as most people know, the drug trade name is Ozempic, is increasingly being used for management of diabetes and obesity. The indications of these group of drugs actually is expanding. It's now been researched and proven to be beneficial for addiction, for neurological conditions such as Parkinson's, and many such conditions. And therefore, there's no question that these group of drugs will be increasingly being used by the general population. One of the downsides of these drugs is that they delay gastric emptying, which can increase the risk of aspiration under sedation and general anesthesia. And therefore, we chose this topic for presentation at the SASM meeting because of the safety concerns.
Do you know what proportion of patients are on GLP-1s now who are presenting for ambulatory surgery?
Not really. We don't have the exact numbers. And the reason for that are several. Because most of the data comes from the pharmaceutical companies or the health insurance companies. But there are so many patients who are using these group of drugs for obesity, which is off-label use as well as compounding. They're getting these drugs from other countries like Canada and Mexico. And therefore, to really know the exact numbers is impossible. But we know that it's more than what's been thought as presented by the insurance companies.
Right. And I would imagine that there's a lot of people out there on GLP-1s whose physicians might not even know that they're on these medications.
Correct. And that is one of the reasons why several years ago, and to be exact, in 2023, the American Society of Anesthesiologists decided to come up with a kind of letter and also guidance to explain to anesthesiologists and other anesthesia practitioners, as well as patients, that there is a concern with these drugs. So it's important that you tell your physicians about using these drugs if you were to receive sedation or general anesthesia.
Yeah, it sounds like it would be very important to get that word out to patients. As far as anesthesiologists are concerned, and other people who are evaluating patients prior to having surgery, do you think that most of those providers are aware of the potential complications of GLP-1s in the perioperative setting?
Yeah, I think so. Now that the word's been out, and in fact, there are numerous recommendations or consensus statements. Last I checked, there were about 15 of those from all over the world. And these consensus statements obviously has heightened the index of suspicion amongst anesthesia practitioners. However, these consensus statements are also contradictory. And so that confuses the average practitioners out there because they don't know which one to believe and what to follow. So the aim for this particular talk is to basically decipher the complexities and contradictions from these different consensus statements. And my hope is to then make some sense out of them and present an organized approach to patient care and for patients using these group of drugs.
Yeah, that seems like it's really, really needed at this point in time because there aren't any really, guidelines that are out there about this. Is that correct?
Correct. The reason why there are no guidelines per se, there are guidances, recommendations, consensus statements, but no guidelines, because for guidelines, you need robust evidence. Unfortunately, though there are several studies, in fact, a huge number of studies that have been published on the effects of these drugs on delayed gastric emptying and the potential for aspiration. None of these studies are really good in the sense they're retrospective, or even if they're prospective, they're observational, and therefore good evidence regarding management of patients on GLP-1 receptor agonists in the perioperative period or peri-procedure period does not exist. Most of the evidence is really not good, and therefore no guidelines as such could be presented. And lack of such good evidence is the reason why there are so many contradictions between the different guidances or recommendations.
I see. Sounds complicated. Hopefully, guidelines will be coming soon.
Yeah,
We can
we'll hope
expect.
so, but that's why the aim of this lecture basically is to present to the average practitioner out there, while we wait for good evidence, what should one do and how should one proceed to improve patient safety?
Excellent. Is there anything else that we should know about the talk? Any new and exciting information that you're going to be presenting apart from what you just told us?
Yeah, no, what I'm going to be doing is presenting the several controversies that are associated with the use of these drugs, and then go in an organized approach as to how do we address these controversies, and finally provide an algorithm which is based on multidisciplinary guidance from several societies, including the American Society of Anesthesiologists, and thus give the best current approach for caring of this group of patients.
Any fun plans for San Antonio?
Oh, the ASA meeting is one of the busiest meetings for me. Usually I give a refresher course lecture and maybe a panel, but this time around I have 5 talks, and 3 of them are related to the GLP-1 receptor agonists, because I was the first author for the ASA guidance on managing patients on GLP-1 receptor agonists, as well as I'm co-author for that multidisciplinary approach to caring of these patients. So it's going to be busy, but I'm looking forward to meeting my friends, and SASM, and meeting you as well, and then meeting many others from outside the US.
Great, wonderful. Well, thanks again for meeting with me. And everyone, please come to the Society of Anesthesia and Sleep Medicine conference. It's October 10th in San Antonio, Texas. It dovetails very nicely with the ASA conference, so you can go to both all in one go. And thanks, Dr. Joshi, for joining us today.
Thanks, Kara.